Hi guys, I want to start this video by adding a disclaimer. I want to say that I am talking about solely my experience and my experience with only one surgeon. I am not aware, nor have I investigated any other surgeon other than the one I knew pretty much from the beginning of my transition that I wanted to do my top surgery. But I'm going to talk a little bit about the process that I've gone through in setting a date for my top surgery, and the things that are required for me to do before top surgery, and then talk a little bit about the emotions that I've had since setting my date for top surgery. Okay. The doctor that I chose is Dr. Garamoni, which I know quite a few guys on here have gone to have their top surgery. My deciding factors were pretty much results. Results that I liked, that I favored, that I felt I could live with in the end. So basically for me, the process was, scrimping and saving the money just like everyone else, and then basically just trying to figure out a time that was good for us, the both of us. Catherine goes to school and works, so we had to pretty much figure out a time when she would be off from school. So basically how I started the process was, after we knew we had the money, was making sure that I would have my letter right away. And so I went back to the therapist who wrote my T letter and had a very long conversation with him about wanting to continue to progress in my transition. And he had a lot of questions about whether or not I really felt like I was ready, or if it was what I really wanted. And in the end, we decided that yes, this was the next step in the process. And so then I contacted Dr. Garamoni via email, and was contacted by his office telling me what I needed to do to set up a consultation, which was fairly simple, just pretty much providing them with some information and some images of your chest. Looking at the timer now, this may get very lengthy, and I may actually just divide it into 2 videos. But anyway, that's off topic and besides the point. So then I was contacted again after I sent the information, and they set up the consultation with me over the phone. And then I had a phone consultation with Dr. Garamoni himself, in which we talked about my size, which I'm a larger guy, and we talked about what the options would be, what the procedure is. I ask many questions, which if any of you are interested in the questions that I ask or the answers, let me know, because the process is it's the same process as far as the procedure goes for a larger person, but there are things that that would be a little different from a smaller or average size guy. So pretty much then at that point I just asked, when can I set up my my surgery date, and he transferred me back out to the office, and I paid my deposit and set up my surgery date. So it's a fairly easy process. He was very nice. He was very willing to answer any questions I had, and I had many. Mostly to do with concerns of results and things like that because of my size. But I'm going to go ahead and like finish this off talking about the process, and then I'm going to talk about the emotions in a second video, which I'll make here in a few seconds. Basically, as far as the process goes, you know, they sent me prescriptions to have blood work and a mammogram, which the mammogram has to do with, you wouldn't have to have a mammogram if you weren't over the age of 35 for Dr. Garamoni, except for the fact that I have a sister who is who has breast cancer. So he's going to require that I have a mammogram, and then there's some blood work, and then obviously, you know, a physical release from your family physician. These are the things that are required to have surgery with him, as well as, you know, a letter from your therapist. Actually, his list says from your therapist or a family physician, stating that this is, you know, the next step in your transition, and that you are, in fact, ready for that step. If there's any questions about the remainder of the process, go ahead and ask me. I'm not really sure, you know, if there's anything people really want to know. A lot of people have gone to Dr. Garamoni in the past and have covered a lot of, you know, the details. But if anyone has any specific questions, please ask. Okay, I'm going to stop this here and move on to the next video. Alright, here in a few seconds. Alright, bye guys.